So giving insulin, it's going to be the same like basic principles as we give any other injection. So we're going to check our doctor's orders before we give anything. We are going to make sure we have our 6 rights. So we're going to have our right med, our right dose. Sorry, my chair's moving everywhere. Our right med, our right dose, our right patient, our right route, our right time, and then documentation. So when we go get our insulins, if we're mixing insulin, we're just going to make sure, and we have our cloudy and our clear, and we're going to go cloudy, clear, clear, cloudy. So we're going to inject our air into our cloudy, inject our air into our clear, withdraw our clear, and withdraw our cloudy. Okay, so when preparing our insulin, we're going to wash our hands. We're going to check our MAR. We're going to check our MAR when we pull it out of the Pyxis and when we're checking the orders. So we're going to wash our hands. We are going to clean, and I'm just going to go ahead and do it because I think I have like 20 alcohol pads in there. So I'm going to go ahead and clean the tops of my vials. And then I'm going to go ahead and start to withdraw. So, I mean, we can do 5 units cloudy, 5 units clear, just for this little procedure. Typically, we would have an order. So I'll go ahead and inject 5 units of air into our cloudy.
Well, they don't use it till after lunch.
Inject 5 units of air into our clear. And the problem with these is that we can't really change out our needle, and so it can be a little more painful for our patient, but we're just going to try to make it as painless as possible. So we're going to go ahead and withdraw our 5. We're going to make sure that we don't have any air in there. And we're always going to have a nurse check. So I'll have another RN check, make sure I have 5 units, and then we'll go ahead and get our 5 units out of our cloud. And we'll make sure another nurse is with us, making sure that we have the right amount. Since insulin is so dangerous, it can cause that hypoglycemia, and we do not want that, and so we'll always have somebody check. We'll recap just for transport. We'll make sure that we label it. Okay, so we'll discard. Our insulin vials are usually multi-dose, but we'll stick this to the side. Okay, so when we're going into our patient room, we're going to assess our patient. We're going to take their blood sugar. We're not going to give somebody insulin that already has a low blood sugar because we don't want them to have hypoglycemia. So, and depending on the type of insulin we give, so if we're giving long-acting, we'll give our Lantus like in the morning and it'll last 24 hours. But if we're giving a short-acting insulin, we're always going to make sure that our patient has food right there on the table and that they're eating the food. We are always going to make sure that we have the right patient. We're going to scan their bracelet, ask them their birthday, 2 patient identifiers. We're also going to check our MAR again. So overall, we'll check it 3 times. We checked it when we checked our orders. We checked it when we pulled our meds out. And we're going to check it again right before we give it to our patient. So we're going to assess our patient for hypoglycemia, hyperglycemia, see how much insulin we need to give. Sometimes that's also based on a sliding scale. So I have my insulin drawn up, a nurse has checked me, we're in our patient room. So we ask our patient if they are feeling okay. That's just part of our assessment. We ask them their birthday, check their armband. Okay, so now we're going to go ahead and we give our insulin usually in our sub-Q and our abdomen. Also with the insulin, we want to make sure, especially with our long-term patients, that we don't have a bunch of scar tissue built up to where we have the fat and the scar tissue metabolizing the insulin differently. So we'll go ahead and have our our abdomen and our sub-Q. So we'll clean that. We'll make sure we wash our hands. And we're going to go ahead and put our gloves on. There's a lot going on today. Put our gloves on. And honestly, since insulin is such a high alert, I'd go ahead and check it again. Just make sure, okay, this is what we gave. This is what we have drawn up. Talk to our patient, and patient education is also a big thing, especially if they're a new diagnosis. Just let them know this is how they can do it, or we can give it just whatever. So we're going to have our abdomen, it's clean, it's dry. We'll uncap our needle. Check one more time. We have 10 units, 5 of our MPH, 5 of our regular. So we'll pinch up that sub-Q. We can do 45 or a 90. We have a good amount of fat here, so we'll just do a 90. We're gonna go ahead and give it. Discard our sharps. Okay, and then immediately after, we're just gonna assess our patient again. I mean, come back. We're gonna go document. We gave 5 units of each. We'll have our witness ID with our RN. We're gonna document how we gave it, how much, where at, what the site looked like, and then we'll come back and assess for hypoglycemia as well. And what else are we assessing? We are just gonna make sure it's working. We're gonna check for hyperglycemia as well. And so then we just document that with all of our stuff, our information, and then we'd wash our hands and we would leave.